Good afternoon. We're going to give you a few minutes for more people to join, and we will start soon. Thank you. Good afternoon. Thank you for joining us today. My name is Marcela Geminani, and I'm the Director of Diversity, Equity, and Inclusion for Allergy and Asthma Network. Welcome to the Unidos Hablemos virtual conference series, which addresses ongoing disparities and barriers to care for the Hispanic Latino community living with asthma, allergies, and related conditions. We have a few housekeeping items before we start today's program. First of all participants will be on mute for the conference. The webinar will be presented in Spanish. For English interpretation, please select the globe icon at the bottom of your screen and select the English channel. This presentation will be 1 hour. It includes time for questions. We will take the questions at the end, but you can put your questions in the Q&A at any time. The Q&A box is at the bottom of your screen. We have someone monitoring the chat if you have questions or need help. We will get to as many questions as we can before we conclude today's conference. We will not be offering continuing education credits, but we do have a certificate of attendance if you need it for your records. You'll receive an email with supplemental information and a link to download the certificate of attendance in a couple of days. I'd like to introduce to you our moderator for today's program, Angel Melendez. Angel, I'll turn it over to you. Thank you, Marcela. My name is Angel Melendez. I'm a respiratory therapist and certified asthma educator from El Paso, Texas. Today's presentation is called Eczema and the Hispanic Latino Culture. First, we'll have Dr. Vivian Hernandez Trujillo talk about what eczema is, how it's diagnosed, how it's treated, and what are some barriers to care for the Hispanic Latino community. Then Joseph Bebo will talk about his experience as someone living with eczema and caring for a child with eczema. We'll talk a little bit about clinical trials and the importance of diverse representation in research. And finally, we'll answer some questions from the audience. Special thanks to Insight, who has provided funding support to make this conference possible today. It's my pleasure to introduce our first speaker, Dr. Vivian Hernandez Trujillo. Dr. Hernandez Trujillo is a clinical associate professor at Florida International University, Herbert Wertheim College of Medicine in Miami, Florida. She serves as the medical director for the Division of Allergy and Immunology at Nicklaus Children's Hospital. Dr. Hernandez Trujillo is a fellow of the American Academy of Pediatrics, American Academy of Allergy, Asthma, and Immunology, and American College of Allergy, Asthma, and Immunology. She's also a member of the Clinical Immunology Society. Thank you for being here today. Dr. Hernandez Trujillo, I will turn it over to you. Thank you so much, Angel. It's a pleasure for me to be here today and to be able to talk about a disease that affects us very much. As a mom, I had twins, and one of my twins had eczema. And obviously, I'm an immunologist, and as a doctor, I am in a position of helping families and patients that have eczema. First of all, we're going to talk about what we'll be chatting about today. We'll be talking about the summary, what parts of the body are affected, what are the factors that cause it, and I would like to talk about the eczema and health. And it's also very important today to talk about the quality of life and mental health, because when you have a disease or a chronic illness, it affects us physically, but it also affects our emotions and mentally. And if we're not okay, then we cannot be okay with the other issues. We'll, we'll be talking about treatment and questions that we'll be asking during your medical visit and what information can help us out. And we'll have a summary. What is eczema? It's a skin condition that presents dryness, itchiness, eczema, atopic dermatitis. These are words that can be used interchangeably. Eczema in people suffering from allergy is known as atopic dermatitis. So today I'm going to talk about eczema, atopic dermatitis, but we're talking about one disease, and atopic dermatitis can also be used part of the atopic march. And we'll be talking in the next slide, what is the allergic march? As a pediatric immunologist, and I see allergies every day, because the allergic march or the atopic march talks about how the natural progression of allergic diseases start many times during infancy, and they continue on until you become an adult. As infants, you can see skin irritation, you can see eczema, you might see hives. It all depends on the patient. It can present in infants or sometimes as food allergies, and the 8 most common ones that I'm going to talk about very briefly: peanuts, tree nut, cow's milk, eggs. These are all very common in children or infants and toddlers that are younger than 3 years old. Also wheat, seafood, fish, soy. When the child or the infant starts to grow up, we see environmental allergies, we see seasonal allergies that can affect allergic rhinitis. So then I tell patients, we start with the skin, and then it might affect us as a food allergy. It might affect us, it might affect the nose, the respiratory tracts. It might also affect us in a way presenting as allergic rhinitis, and then the allergic march might end up as asthma, which is a chronic disease characterized by inflamed airways in the lungs. So the question is, how does it feel, and what does eczema look like? So this is the first poll question that we'll be asking. We'll be asking everyone, is eczema contagious? So the question is eczema contagious? And we have the answers here. If you can please pick number 1, yes, number 2, no, or number 3, I don't know. Very well, 95% said no, 4% said yes, and the other percentage said, I don't know, let's talk about this. So the experience of eczema, just like any other disease, any other chronic disease, varies from person to person. There is a stigma that exists around contagion. Can I give it to someone? Can I be contagious? In reality, no, it is not a contagious disease. And then the stigma about being unkempt, or you're not hygienic, or you don't take a bath, which is not the truth. Eczema also doesn't mean that a person is dirty. I've had patients that have told me, young children, teenagers, they told me that other kids, because we already know we live in this world and society that not everybody behaves in a way that people should behave, and they say, oh, you're dirty because of your skin, which is not the truth. So let's talk about how common is eczema. It develops, as I said, in the first 6 months. Sometimes it starts maybe in the first weeks of life, sometimes after a few months, and through 5 years old. Usually it starts when you're young, and it affects more than 31.6 million people in the United States. So it affects a lot of people. Almost half of these patients are adults, 9.6 million are children that are younger, and of all of these patients, 3.2 million are moderate to severe. I like these two photos very much because it shows that there is a difference, that if you have eczema as a baby or an infant or a young child, mostly you see the scalp is being affected, behind the ears, the cheeks, the folds of the elbows, the wrists, and also the knees. And mostly it's in the exterior area of the body, not the interior. And once the patient starts to grow, you see it mostly in older children or teenagers or adults. You see it on the eyelids, you see it on the face, the neck, but the arms, it's very common for the arms to be affected, and the inner area where the elbows close, where you close your arms, the wrists, the hands. It's very common to have atopic dermatitis or eczema on your hands. It's very uncomfortable because, you have to wash your hands often, especially with what's been going on during these last years. We're trying to not to get these respiratory diseases that we've seen during these last years have increased, also behind the knees, the inner part of the knees, and also the feet. That's very common. Once again, it might be very itchy on the feet, and it might affect your feet very much because, we have to wear shoes, we have to wear socks, and these are areas that are irritated. I talk a lot about the itch scratch cycle. When you have eczema causes itchiness, but you might have your skin without any type of dermatitis, and the patient will feel itchy. So it's important to break this cycle, the itchiness cycle. You scratch, you damage the skin barrier, you break the skin, and then you might have allergens, irritants, bacteria enter that area of the skin, and it might cause an infection. It might cause inflammation, redness, and obviously the skin will look worse. The skin will get worse. So we have to stop the itch scratch cycle, trying not to make the skin get worse. So this cycle is very important. It's very important to talk about the cycle and that we have to break that cycle. Now we're going to talk about the triggers, the 6 most common eczema triggers. And this is generally speaking because obviously there are a lot of different triggers that can cause and make eczema worse. Dry skin. This dry skin, we have to attack it, and we have to do it very intensely. And let's talk about how during the part of the treatment. We also see food allergies. We've spoken about the most common ones. I didn't talk about number 9, which is also part of the list of these food allergens when they sell a product. So there are 9 foods. The 9th one, which is sesame. Sesame is the 9th one. And then we also have environmental allergies. These last all year. These are perennial. It might be cockroaches. It might be mildew. Could be our pets, cats, dogs. And we also talk about seasonal allergies. The seasonal allergies like pollen, from the trees during the springtime. That's very common. Pollen from the trees. It could be the pollen from grass, and that mostly happens during the summertime. And the pollen, from weeds, this happens also during the fall, during the autumn. Of course, it depends on what part of the United States you're located in. It all depends on that area, the seasonal allergies. But of course, we have different allergens that can trigger all of these allergies. The fourth one are the contact allergies, and these are different chemicals. These are different products. It could be the fabric of the clothing that you're wearing. The fifth one can be caused by skin irritants. You might be using a product that has some type of fragrance or something that you're allergic to. And then the sixth one is heat. Heat definitely is a trigger. I live in the south of Florida, and whenever, it starts getting hot, right now it's really hot in different parts of the United States. The temperatures are high, and heat definitely makes it worse, and it causes itchiness, and it makes the skin to get worse, especially in patients that have eczema. So it's important to have this in mind. So how to work with your doctor when they say your skin doesn't look that bad. It doesn't look that bad. So number one, me as a doctor, this bothers me very much because I don't know what the patient is feeling. So if a patient tells me, or the parents tell me, the child doesn't feel well, he doesn't look well, but he feels sick, I have to take this very seriously. And it's very important to speak with the medical team, with everyone, not only the doctor, could be the nutritionist, could be the psychologist. It can be different members of this medical team. So you have to feel that you're being listened to. That's very important. You have to feel that you're being heard, and you always have to be an advocate for your rights and your family, and feel that you're being heard. Because if you feel, well, the doctor says, oh, you're not that bad. Oh, but I'm telling you, I don't feel well. Then you need to speak to the person, make sure the person is understanding you. But if this person does not understand you, then it might be time to speak to another doctor, to perhaps go to a different medical team that makes you feel like you're being heard. It's very important. You must advocate for yourself. How to keep in generally good health and why this is important for eczema. Number one, as an immunologist, I think it's very important to take care of your body and your health in general. This is very important. You can do it in different ways. Number one, eat healthy. This is especially for children. They don't want to eat fruits. They don't want to eat vegetables. They want to eat junk food, food that like sweets. But in reality, it's very important. You tell children you can eat a little bit of everything as long as you have no food allergies. And we'll be talking about this in the next webinar. You have to eat a little bit of everything, but you have to moderate and you have to vary. Another important thing for health, for your immunological health, is to sleep enough. You have to sleep 8 hours. This is very important because if you have any type of medical condition, especially if it's something chronic, it can affect you. Your sleep can affect you, and you have to rest to make sure that your health in general is good. I always give the example of students that are going to college and they study at all hours to be able to pass all their exams, but they always come back, they're sick, they have some kind of infection, and this is because their immune system went down and the eczema got worse, and this is all caused by stress. Another thing is exercising. If you can exercise, it doesn't matter what type of exercise it is, whatever you like. It can be walking. You don't have to run a marathon. If you can run a marathon, perfect, but it's important to exercise. I always tell my patients, do you like to dance? Go dance, because it's very important. Latino music is very important. It's good for dancing. So this is a way of exercising, and it's very good. You also have to control your stress. Ever since the pandemic, I can tell you that I always spoke about stress, but during these last 4 years, I'm talking more and more about how necessary it is to control stress in one's life. Stress affects us in very bad ways, not only mental, but physically as well. And stress is terrible for eczema. I have patients that tell me, oh, my child yesterday, he started to cry because we took the toy away and he broke out in eczema. Yes, because stress is very bad. So trying to control stress, I have a lot of patients that recommend to speak to a psychologist. So there are different ways of controlling stress. Obviously, infections can also provoke for your eczema to get worse. I spoke about this a little bit before. Now we're going to talk about the quality of life, which is very important, and talking about mental health concerns, which is a very big problem in the United States and all over the world. I spoke a little bit about the need to control stress. I speak with patients. I tell them if you do not have time for anything else, I want you to 3 times a day, sit down, take 5 seconds, breathe, take deep breaths 3 times, breathe in, breathe out, just to help a little bit with stress. When children say to me, I'm very stressed out because I have to take a test, take 5 seconds before the test and do what I said. Breathe in, breathe out, take deep breaths just to release stress, because stress definitely can affect you, can affect eczema very negatively. And lots of studies have said that sleeping difficulties can cause depression, anxiety in adults. So once again, eczema can be a result of that, but it's also depression, anxiety that can exacerbate eczema. So it's both ways. In children 5 to 17 years old with eczema, they've seen sleep disturbance occurred in 2/3 of these patients. And this is really bad for everything. For learning, of course, it's really bad. Also, the odds of severe sleep disturbances, worse than 95% of US children, were highest in moderate to severe versus mild, in comparison to patients that have a low level of eczema. And sleep disturbance affects 3 million US children, and this is associated with neuropsychiatric impairments, including depression, anxiety, and inattention. And once again, this is very important because children have to learn, they have to be awake, and they have to be able to enjoy. And if they're not sleeping well, then that's not possible for certain patients. So now we have question number 2, poll question number 2. Do Hispanic Latino children have higher or lower rates of eczema compared to non-Hispanic white children? Do Latino Hispanic children have higher or lower rates of eczema compared to non-Hispanic white children? Number 1 response, Latino children have higher rates than non-Hispanic white children. Number 2, Latino children have lower rates than non-Hispanic white children. And response number 3, I don't know. You can answer. 75%, yes, correct. Latino children have higher rates than non-Hispanic white children. Perfect. Now we're going to talk about this. We're going to talk a little bit about eczema in Hispanic Latinos. And yes, disparities exist. We've learned a lot during these last years. In a retrospective cohort study of children aged 0 to 17 years old with eczema seen in allergy immunology clinics at 2 urban tertiary care centers in the United States. These were specialized centers. Hispanic or Latino children had higher rates of eczema in comparison to non-Hispanic white children. A study of 7,522 children, 11.5% were Hispanic or Latino, followed for a median of 4 years. So this was a long-term study. And after adjusting sociodemographic factors, Black and Hispanic children were up to nearly threefold more likely than white children to receive medical care for eczema across almost all levels of eczema control. Black and Hispanic children had higher odds of primary care and emergency visits compared to whites. So we know that we are a group, we are a community, we are very affected by eczema. So this I took directly from the study, improving awareness among primary care physicians to refer children with moderate to severe eczema to medical specialists, allergists, including allergists, dermatologists, and mental health attention deficit hyperactivity disorder professionals, when necessary, could improve quality of life and reduce emergency department visits, especially among minority race and Hispanic children. And this is very important, just like we spoke about this before. Poll question number 3. What are important parts of an eczema treatment plan? Check all that apply. Skin care, bath and moisturizer. Number 2, medicine as needed. Number 3, coping strategies, managing itch, stress, and other issues, controlling the itchiness, the stress. And number 4, trigger avoidance to prevent flares. So what are the important parts of an eczema treatment plan? Check all that apply. You can respond. Perfect. As you may see, you've picked most of them, which in reality, that's what it is. We have to talk about each one. So now we're going to talk about the treatment. So treatment, first of all, it's necessary to make the correct diagnosis. We have to know what condition, what skin condition it is. We have to address the skin barrier issues and xerosis, dryness. And we're going to talk about how to do that. Moisturizer, skincare, all day long. It's very important not to do it only once, but you have to do it throughout the day. Beware not to overuse the potent topical corticosteroids and consider topical calcineurin inhibitors, PDE4 inhibitors, or dupilumab. And we're going to talk about that a little bit. So we're going to talk about what I wrote here. You can see that everything has fragrances and you can see flowers and it all looks very pretty, but this is not a good thing for eczema patients, and this can result in negative things. I did not want to forget to mention that. Obviously, skincare for people with eczema, safe, sensitive. We have to avoid triggers. We have to make sure that we're doing skincare, need for frequent moisturization, not only once a day, but you have to keep doing it throughout the day. Creams are preferred to lotion because lotions are, they're very quick. You need something that's better for you. It's healthier, like creams. We have to use hypoallergenic or allergen-free products, paraben-free, because some patients might react to it. Regarding medications during these last years, we've seen a lot of different options, and it's been very important for our patients, and it has improved the quality and the life of people with eczema. Topical steroids and topical calcineurin inhibitors for mild, moderate, and severe eczema. And it's just really important. Biologic dupilumab and tralokinumab. These are injections for moderate to severe eczema. PDE4 inhibitor for mild to moderate eczema, which is crisaborole. And you can use this in 3-month-old babies and older. And now, recently, we've seen the JAK inhibitors for mild to moderate eczema. This is from mild to severe also. These are creams and they come in a tablet form. We have a lot of medications that did not exist before. We also have topical steroids. It's recommended to use a low strength and dosage that is effective because obviously if you increase the dosage, it's a higher dosage. Creams, not as strong as ointment. We do prefer using creams. Side effects. This can result in skin thinning. It might change the color of the skin. So it's important to use only when necessary, but if it's not necessary, don't use it. We recommend 5 days on, 5 days off. The skin has to recover and rest when you're using these topical steroids. I also would like to speak about the bleach baths. This is used for moderate to severe eczema, and you can add this to the other types of skincare. You can use 1/4 to 1/2 a cup of bleach in a tub of water, soak for 10 minutes, rinse with fresh water, and you must avoid using it on your head or eyes. What are the reasons patients and families may not use medications? This is very important for me as a specialist. Perhaps the medication is not available. Perhaps it's limited availability. Perhaps the physician is unwilling to prescribe adequate amounts of medication because of concerns about toxicity or cost. The medication sometimes is available but not used. Patients or parents are unaware of the correct frequency and the type of medication that should be applied for effective management of eczema. Perhaps the perception on behalf of the patients or parents is that the treatment does not work, or the perception from patients and parents is that the treatment has unacceptable side effects. And in that case, I recommend to speak to the medical team so that the side effects can be explained and what worries you so that you can pick medications that make you feel safe about using them. Patient parents' perception that the treatment is cosmetically unacceptable, for example, shiny ointments to the faces of teenagers. Perhaps they don't want to use it because they don't want their faces to look shiny. This is what patients have told me. The medication may make the eczema worse or the atopic dermatitis, or perhaps the medication is too painful to apply. This is another reason why it's not used. And we're going to speak briefly about the access to medications. Generic versions are available for many medications, and these are very good options. In a lot of cases, there are programs that exist to decrease the cost of medications. I'm going to share some here: GoodRx, Single Care, WellRx, Cost Plus, Blink Health. These might allow you to obtain the medication without having health insurance. You might be able to use these programs to reduce the cost. And some of the companies produce these medications and they might provide drug assistance programs. These are all possibilities. Regarding treatment of allergic conditions, if a patient has allergies to certain allergens, it's important to avoid exposure. This is very important. The environmental control is needed and it's helpful. Certain allergen or control barriers, for example, wearing long pants, using long sleeves, dry wraps, bandages, bodysuits, especially for infants and young children, because, you know, they might want to scratch. Also using dust-proof covers for mattresses and pillowcases. Avoid playing on the grass if you're allergic to the pollen from grass. Avoid sitting down, playing on the carpet if you're allergic to dander. Minimizing carpeting, drapes, upholstered furnishings. Also decluttering, removing fluffy toys and excess pillows. These are all different types of controls. The importance of the relationship with the medical team. Obviously, medical teams may include several members. It's not only the doctor, but it's very important that you feel comfortable and well. It's important to trust the medical team. It's important to be honest. It's also a necessity that you be heard and you need to be understood in your primary language. So, you know, if you can talk to them in your primary language, that's the most important thing so that you can be understood. And then I will give you some ideas regarding the questions that you can ask during the medical visit or information that you should have at the time of the visit. What makes eczema better? You can ask your doctor, or the doctor can say, what is helping you? What is making the eczema worse? When did eczema start? Is there a family history? If there are members of the family that have this condition, you might want to make a list of questions. You know, you have the phones now, you can take notes, you can ask the questions, all the concerns before the visit so that you know what you're asking. You can ask about a care plan when you see it starts to get worse, asking about a care plan when skin is well controlled, because perhaps the plan might change. And also ask about concerns regarding medications so that you can feel that the medication that you're using is safe. So, summary: eczema has many triggers, eczema affects quality of life, and yes, there are many treatment options that are available. Thank you so much for your attention. For more information, visit https allergyasthmanetwork.org. What is eczema? Thank you, Dr. Hernandez. Everything was very informative. I would like to introduce now Joseph Bibo. He's going to share his story about living with eczema and how to raise a child that has eczema. Thank you so much for being here today, Joseph. Hi, everyone. My name is Joseph Bibo. I was raised in Panama. After that, I went to Puerto Rico. I was raised in Panama. I'm American. I am the child of Americans, born in Panama. I lived in the area with channels, and it was the military service of the United States and the workers, the American and Panamanian workers. So I was raised with both cultures, Panama and America. I am 46 years old now. I was diagnosed, or at least when I first had my experience with eczema, it was when I was 8 years old. It was around 1986. And in my family, no one had eczema, no one had experience with eczema or with allergies. So it was something completely new, and it was strange, and we had no precedence of it. So my first experience was, being home, playing with my sibling. I was a very active child, so was my sibling, and we ran, we jumped, and we were in the yard. We had grass in our yard, we had trees. And all of a sudden, I had a flare up. I had hives all over my back. I went home, I showed it to my mother. My mother didn't know what to do. It was something completely new. So our instinct mainly was to try to find, remedies, home remedies. So they put calamine lotion on me. And this is something that was recurring. So we continued looking for home remedies. We used rice water for the skin. We would apply it to the skin. They started to give me oat baths, but eczema kept coming back. It kept coming back. And then with time, we decided to visit a doctor. I don't know if we went to see a primary care physician or a pediatrician, but they evaluated me. First, they said there was no infection or any other type of skin condition. But then as time went by, the diagnosis, I don't remember if it was with a general care doctor or if it was done with a dermatologist, but it was atopic dermatitis. And, we said, okay, well, what do we do with this? So I was diagnosed with atopic dermatitis, and in general, the treatment was, to treat the symptoms, which is I had itchiness, I had hives, I had a rash, my skin would get very dry, the dry would get wrinkly, and I just had a series of symptoms, which also included the ganglions would become swollen in my neck and the upper area. And a lot of times, because of our ignorance or lack of education at the time, understanding the condition, I never stopped being active. And I didn't know that for my type of skin condition, I needed to have some type of care and hygiene that was more particular for me. So I would get a lot of infections. And then because I would get these infections, they would give me a lot of antibiotics. And I would have to take care of myself, avoiding infections. And then once I started to understand what it was, I started to take care of myself better. And then I know that if I had eczema, I know I would have to keep the area clean, and I would have to put cream on it and just take care of myself. But we noticed that the eczema kept coming back over and over again. And we really didn't have some type of control of it until we saw an allergy doctor. And this allergist performed a lot of tests. They did a scrape of the skin. This is done on the arms, it's done on the back. They also did blood work. And that's when they said I had allergies. I had severe allergies, moderate to severe. I was allergic to a lot of different things. So this was a process, a very long process. I had to learn, had to identify the triggers, the allergens that were causing my eczema. I had skin, the contact dermatitis. There were certain things that if they touched me or if I wore certain things or certain shirts or certain clothing, it would cause a reaction. I am still allergic to a lot of different foods. So this was completely strange to my family because no one else had this problem. And it's very difficult because we have our habits, our customs that, socially it's based on what we eat. So we would go to parties. There were a lot of things that I couldn't eat. If I went to a birthday party or there was an activity or traditional foods, I could not eat them. At home, it was also a little bit complicated. My family did not know what to feed me. So it was a whole process. And we never had a very good control of the subject. So I was also prescribed things. I tried a lot of different things. I've tried every cream, every humidifying cream. I've tried every soap. I've tried home remedies. I've tried every medication. I mean, not literally because there are certain things that I haven't tried, but I would say there's a very high percentage of medications and things that I've tried. So my diagnosis, my eczema diagnosis was done. And then further ahead, they diagnosed the triggers, certain things that I react to. But truthfully, my skin condition evolved, got worse, and I still don't understand why. But if I started with a certain type of allergens, I didn't have the good luck that, some kids get eczema, but then it goes away. In my case, it did not go away, it stayed. And I started to develop more allergies. And because I was not understanding what was going on, I kept eating and I was never able to have full control of my eczema. So one of the medications that they gave me when I was a teenager or preteen, the topical steroids in my case, I had to start because there are different levels. Some of them are low dosage, and I think I started with the ones that were in the mid dosage because the low ones didn't really do anything to me. And I would use them very little because in my case, it would only provide temporary relief. And I only used it when it was really bad and I couldn't do anything else. And because the itchiness was very intense. And that's how it was during a long time, during many years. I managed my eczema. In my case, it's caused by allergies and allergens that I have to control. And then as years went by, I kept a very strict diet, which was recommended by the allergist. Every now and then I used steroids. I also used antihistamine medicine, but I never had a very, very good control of the eczema during that time. But, I felt some type of relief when I used the medications. And that's how my entire high school was. I covered up, I covered my skin. I was always, self-aware. And I tried to hide my eczema. I tried to control the eczema. And I tried to avoid all of the things that triggered it. But then as an adult, as time went by, because I lost control of eczema when I started to work, I got worse because my job was very competitive and I would prioritize working and, trying to compete for an increase, for a promotion, for a position. And I wasn't taking care of my diet. So when that occurs, I start to depend more on medications. I started to use the antihistamines and steroids. And then as time went by, my eczema started to get worse. So the treatment that was provided during the time, these were very strong steroids. I used the very, very strong ones. And then I had to receive other types of steroids, systemic steroids. And this is when the eczema is already spread out of control in a very aggressive way. It tries to suppress your immunological system. And I tried to calm down the symptoms. In the beginning, it would work. It wasn't really a long-term solution. It wasn't something that was going to last. It would last maybe a week. But, it calmed down the crisis that I had. But it became a habit. I was never able to return to that point of having to increase steroids. So it became something that I couldn't do without. I was an addict. I was addicted to steroids. And every time they gave me the steroids, they were working less and less. They were lasting less and less. And the eczema was getting worse, even with the treatment. So in 2011, I was tired of this mentally, physically, and I decided to stop taking steroids. No, I'm sorry. No, in 2011, I had a crisis. And I continued with the steroids. And then in 2017, I decided to stop using the steroids because I found that I was in this, vicious bad cycle. And I felt that it wasn't helping me anymore. And my health in general was being affected. But it's something that I didn't say. But every time that I have eczema, I have sleeping problems. So when I reached the point of not using steroids anymore, it was because I wasn't seeing any benefit to using these medications. And I felt that my health in general was being affected more and more. And then when I stopped taking the steroids, this process started. The translation is withdrawal. It's like a withdrawal. And my body lost control. And I went into this TSW stage, topical stage withdrawal. And I was in this process for 4 years that my system would become normal again. And during that time, I hardly used any medication. It was a full year that I was not able to work. I had eczema over more than 70% of my body. These are photos of when I was undergoing that process. At least the ones that you can see are with the areas that are affected. And then the clear areas you see are from 2 weeks ago when my body, my skin has become normal again. And right now the medication that I'm taking, which is Tupicent has helped me a lot. And I describe it as almost a miracle. It's not a perfect solution, but it's what has helped me the most during all of these years. But it's a combination of things. Tupicent plus accepting that I can't do a lot of things, that I can't eat whatever I want. I can't eat whatever I want. I have to eat the way that I eat, and I do it. And now my skin is healthy. Right now, I don't need anything. I don't use lotions. I don't take medications. I've learned, with this experience, Obviously, you can shower, but you can't take excessive showers. It's not good to shower a lot. I used to shower with hot water because my skin was open and the wounds were open. And, taking a shower with cuts or destroyed skin, it hurts. So I would shower when it was necessary. I would shower every day. I would shower twice a day. And that was something that was affecting me because hot water causes more dryness. Of course, it feels better to take hot showers when you have a rash because it hurts less, but it also causes an effect that it dries up your skin. So if the eczema caused the irritation and I used lotions, and now that I'm taking the medication Dupixent, I don't take this, I don't take hot showers. I don't have any problems in my skin. Sometimes I'll use a little bit of cream or lotion on my knees, but it's not that much, only what I need. and and that's it. I would say that in my case, at least, knowing that my eczema is based on allergies and allergens, I focus a lot on not having contact, not consuming the allergens, and this helps me avoid having the eczema. So I try not to take the medications, and also the Dupixent, which helps the swelling go down and it helps control the antibodies and controlling the skin condition. I forgot to mention that in my case, I focus a lot on my antibodies, which triggers all of these problems and these symptoms, and the immunoglobulin, which, I focus a lot on that. My skin is much better. I'm better than ever. My skin has never been better than it is now, as you can see in the pictures. To the left, you can see my skin is dry. I have a wound. And here it's a little bit worse than what it normally looks like, but it's what I normally had. And my legs, it's like the elephant skin, it's dry skin, it's wrinkled skin. And as a teenager, I had this, and it would stress me out a lot. But you can see the photo on the bottom, the skin looks the way it's supposed to look. So that's where I am now. So I hope I was able to give you something that can help you out on your path with eczema. Thank you so much for telling us your story. We're going to once again talk with Dr. Vivian Hernandez Trujillo and why we need more people to participate. Thank you so much, Joe, for sharing with us and what it's like to live as a patient with eczema. And because of time, I'm going to speak very briefly about this, but it's very important for me as an allergist and investigator. As Hispanics, Latinos, we have to be well represented during clinical trials, because the reality is that if a study is conducted and none of us form part of it, then unfortunately, it won't be understood. We won't know how possibly we're different, or maybe we can improve it in different ways for different groups. So it's important that these investigation and clinical trials include us as Hispanics and Latinos, and we should be volunteers, and there are different benefits. And we can have access to different treatments, and we can contribute to medical knowledge and also save on certain costs and, be empowered. It's important to participate in these clinical trials, possible side effects, or perhaps not being sure about how the treatment is going to work, it's important to discuss these factors with your provider, your medical care doctor, because it's important. We need to be part of these clinical trials so that we can understand, so the Hispanic and Latino community can understand, 18% are affected, but less than 8% of participants during clinical trials identify as Hispanic. And just for sake of time, I'm going to keep this conversation, but definitely it's important that you speak to your doctor, your main doctor, about the possibility of sharing. And thank you so much for your attention. Thank you so much. Now we're going to respond to certain questions from the audience. The question is, what is the difference between Latina and eczema? What's the difference between Latina? Ringworm es un hongo, and there's a treatment. It's important that we talk about it because lots of patients that have eczema, the skin might break, it might rupture, because if you scratch and it's ripped open, it might be affected by different organisms. And I'm talking about the need to use antibiotics. This is for bacteria, but also for fungus. We've had patients that are wrestlers and they're wrestling, and these patients, because let's say they're on the mat and they're there and it's body against the body, and another person might have fungus, obviously that can be transmitted, and we need a different medication. We start with topical antifungal creams, and sometimes if it's really bad, they might need some type of oral medication. But thank you so much for that question. We have one more question. Can you explain if the creams or lotions are better to maintain? If creams or lotions are better for the skin? So what is Joe saying? I spoke about heat. When you take showers with hot water, you might dry your skin even more. But we do know that lotions are not great. It's better to use cream or Vaseline or something, to use a lotion that's stronger, that can moisturize the skin, or something thicker that is better for eczema than lotions. We have a question for Joseph. What is the emotional impact when your child has eczema, if it's moderate or severe eczema? Can you repeat the question? I'm not sure if I understood the question. Can you talk about the emotional impact on the family when a child has moderate to severe eczema? Yes, it might affect the emotional state of the caregivers, because eczema, at least in my experience, I don't think it's the same in every case. It can vary, but it can provoke a reaction. It's happened to me with my own daughter. When I see she has eczema and her condition is serious, regardless of how much experience I have, I feel bad and I want to alleviate her discomfort as soon as possible. And that's when you have to try to stay calm, try to process it as easily as you can, to not take actions that perhaps, that the child should be evaluated and you should make the best choices, because eczema caused by allergies, it's really important to assist with the eczema, but you also have to see what allergy is causing the eczema. In my daughter's case, she has allergy, and her eczema because of allergy has been very well controlled, but she still has eczema on her ear that who knows where it's coming from. And we're still trying to work on it. So it's a process. The same question for Dr. Vivian. Can you talk about the emotional impact on the family? Yes, I think it's very important what was stated by Joe. There are studies that show that the emotional state from the parents and perhaps the grandparents, might not be the parents only, but people that are helping the patient out, the quality of their lives, it goes down, it decreases. It's important because I speak to parents a lot, because if you get emotional, you get nervous, kids notice right away. And sometimes it affects the children negatively, even though it's very hard. And I talk to a person when they have an allergic reaction, when we talk about food allergies during our next webinar, we're going to talk about that. If the parent or the caregiver is in charge of the child gets emotional or gets very nervous or starts to yell, that parent makes the situation worse. And it's the same with eczema. And I agree with Joe, as a doctor, as a patient, or as a parent, it's harder for me as a mother when I see my daughter when she was a baby with eczema, because you have no control and it's just very stressful. So it's easy for me to say, yes, obviously we have to stay calm, but as a mother, it's hard to stay calm. And it's important to remember that we have to try to keep everything as calm as possible, because children notice, and even as babies know when the parents don't feel well. I've seen this in my medical office, and once the parents calm down, the children calm down. Thank you so much. Do we have time for 2 more questions? This is also for Dr. Vivian. Any recommendations for skin care in children that have sensory problems? I see this a lot as a pediatric allergist. Children that have sensory problems, creams, cause more stress on children. So number one, as Joe said, different products are different. Sometimes children that have sensory problems don't like to have something very thick on them because it feels sticky. Sometimes they don't like to have something very watery either, because then they feel wet. So it's trying to help the child out and trying with different products, because there are a lot of products that exist. Not everything works the same way, and not everything feels the same on the skin. Every patient varies. So you have to try different products. We haven't spoken about the antihistamines because we feel that it doesn't help that much. But me as an allergist and a pediatrician, I can say that it might help pediatric patients that have lots of itchiness. Additionally, besides the skincare and just using different creams. But I understand that children that have sensory problems, it might be difficult, but I have seen that trying with different products to see what works and trying to do it when the child is asleep. I tell a lot of patients and parents, wait until the child falls asleep and then you can apply this on the patient so the patient doesn't notice, and that helps a lot. The last question. I'm sorry, this is a good question. This changes at different ages. Right now, at the age of 6 months old, it changes because the directions are different, but the question is 6 months old. Thank you for your time. Thank you to everyone for coming to this presentation. And I would like to especially thank Dr. Vivian Hernandez Trujillo and Mr. Joseph Bibo. I hope everybody learned something new from this seminar. We will have another presentation regarding Unidos Hablamos, and that will be on May 22nd, and that will be at 4:30 p.m. Eastern Time. And this is allergy to foods and the Hispanic Latino culture and additional resources. We will also include the registry for these food allergies. So please make sure that you complete the survey regarding the conference today. And thank you to everyone. Thank you for your time. And we're very happy. I'm sorry. Thank you for the information. Thank you for your time. Bye-bye. Thank you to everyone.